Hello, this is Claire Coles at Emory University School of Medicine, Atlanta. I'm going to talk to you today about a supplement to our grant, Fetal Alcohol Spectrum Disorders in Adults, Health and Neurobehavioral. The title of our presentation today is Adults with Prenatal Alcohol Exposure Underestimate COVID-19 Risk. This study was carried out in Atlanta by myself and Alexandra Perez, and in Seattle by Therese Grant and Susan Stoner. The problem and hypotheses are as follows. We know that adults with prenatal alcohol exposure and fetal alcohol spectrum disorders may have limitations, and this may be associated with problems in executive functioning that leads to poor impulse control, difficulty with planning, and similar problems. This leads to the following hypotheses. Adults with PAE may be less aware of COVID risks and may not recognize the appropriate precautions to take to avoid such risks. We then feel that adults with PAE may report more negative consequences associated with the COVID pandemic. And finally, we were interested to know whether there would be increased morbidity and mortality among this group than when they were compared to their SES matched controls. In order to investigate these issues, we examined members of two longitudinal cohorts, one in Atlanta and one in Seattle, who were followed up at around 39 years of age with a range of 30 to 60 years. Prenatal alcohol exposure, or the existence of a fetal alcohol spectrum disorder, was documented at recruitment, which took place mostly in prenatally or in early childhood. Those in Atlanta were predominantly African American, and those in Seattle, white or Native American. At an in-person interview, 227 participants completed COVID questionnaires, which are listed here, and in Atlanta provided a blood sample to identify markers of infection. We also examined the National Death Index, searching the years 2011 to 2021 to identify any increased mortality that could be observed among the 922 individuals who made up these two cohorts. When we examined these outcomes, we found that both those with prenatal alcohol exposure and those in the contrast groups reported significant impact on daily and family life due to the pandemic. We found, as we had predicted, that individuals with PAE were significantly less aware of COVID risk and less likely to report taking appropriate precautions against infection. However, when we evaluated whether or not there was an increased incidence of social and other factors affecting those in the PAE group, we found that both they and the contrast groups reported multiple negative impacts of the pandemic, both personally and for their families. Thus, there was no increase in the antigen rate among the PAE group over the contrast group, and indeed over the background rate in the Atlanta population, as documented by the Department of Health. We also, while we noticed increased mortality among those with PAE, this was not increased with the onset of the pandemic in 2019. Listed here are a number of the variables that we examined in determining these outcomes. And you'll note that for many of the things that were evaluated, there were no differences between the comparison group of SES matched controls and those in the PAE or FASD groups. All participants in the study reported significant impact of the pandemic. Those in the PAE group did report being significantly less aware of the COVID symptomology, knowing the length of the incubation period, recognizing COVID was more dangerous in certain groups of people, understanding about long COVID risk, or abiding by recommended precautions. There were also some areas in which those in the contrast group reported more severe problems than those with FASD. And interestingly, the contrast group reported more increase in alcohol use during this period. What do we know now that we did not know before? These results suggest that individuals with PAE or FASD are indeed less aware of the symptoms of COVID-19 and take fewer precautions to avoid it than do members of the general public. They were also less well informed about the associated risk factors. However, all the participants in the study reported significant problems associated with the pandemic and for its consequences for social, educational, vocational, financial, and health outcomes. We found that in the contrast group, there were those who more often reported being responsible for other family members and for children, and who reported themselves to have essential jobs and were therefore more impacted in these areas than the alcohol exposed. We feel that those individuals who were alcohol exposed may have been relatively protected by their disability status. And finally, we had no evidence for an increased mortality during the period of time we examined it. However, the mortality sample was relatively small, and there was already a higher rate of mortality among those with FASD. So it may be that it did not reveal itself in this sample. Thank you for your attention.